Hello, everyone. Dr. Anup Kanodia, and let's see here. I think everyone's able to get in. Can everyone, if people can hear me, can you say yes in the chat box? Okay, let's see. Can people hear me and see me? Yes, no? Perfect. Evan, you can hear me and see me? Excellent. Yes, Lisa, perfect. So I want to talk about this really quickly. This won't be long. What I'll do is give some highlights of some stuff that I've been seeing the last couple of weeks. Thinking about how Thanksgiving went, now where we are in Christmas time, and what's in the news, and what should we be doing. And so I'm gonna jump right in, and if people come in throughout the thing, there will be a recording. And for people who, I think everyone knows me, but if not, I'm Dr. Anup Kanodia. I'm a family doc, and I did my residency at Mayo Clinic, my fellowship at Harvard. I trained with a couple years with Mark Hyman. We have a practice here in Columbus, Ohio called KanodiaMD. We're a functional medicine practice. We've been in town for about 8 years now and helped thousands of people out. And we're real excited that you guys all spend some time with us here to help you guys' health out. So what we're seeing is this. Winter's here, indoors is here, and holiday season's here. Even before Thanksgiving, we saw spikes in the numbers. And now Thanksgiving is gone, 2-3 weeks later, what are we seeing is that the numbers are continuing to go up. And the reason why I'm talking today is because of Christmas Eve, Christmas, all of next week, and New Year's Eve. How should we be planning our time, this time together? And should we change it even last minute? That's the question. So, what are we seeing in Ohio and probably across the country? We hear a few things. Number one, Omicron variant is much more contagious, probably 200% more than Delta, and Delta was 400% more than the Alpha or Betas. What do we also know? We also see, probably many of us are seeing this, that this Omicron is less deadly. Well, that's great. Omicron is less deadly, so less to worry about. My answer is no. In Ohio, we have had the highest number of cases ever, and that's fine. Cases means that you get a cold or flu, that's fine. But then what about the hospitalizations? Our hospitalizations are almost at the peak. Means that almost all of our hospital beds here in Ohio are almost full, even before we see Christmas and Thanksgiving, Christmas and New Year's fight going to happen. Meaning what? They've canceled elective surgeries in the Northeast Ohio, and in the Central Ohio, they're going to cancel all the elective ones during January 3rd. So bottom line is that this Omicron variant is something that we should think about and prepare for. And that not hang our hats that less people are dying because of the Omicron variant. Does that make sense? Say yes or no in the chat box for that. So what the other parts of this that's relevant is that we need to also understand that we want to make sure that if we are sick, we have a place to go. and the hospitals are over full. And in the state of Ohio, we have 1,000 National Guards already helping the hospitals out because there's not enough doctors, nurses, etc. That this is something that we should definitely consider during this holiday season. So things that I would say considering about this, and if you have questions, please put them in the chat box. I guess I will say this is that many hospitals across the U.S., I think I've seen these one doctor out of Harvard say 62 counties across the U.S. are 100% full, their hospitals already. And more are happening. So what am I thinking about right now as I think about the holiday season? I'm thinking about churches. I'm thinking about parties. Thinking about anything indoors. What I'm finding over and over, I guess from my seat, sitting here from the healthcare practitioner standpoint, is patients who are getting COVID are saying, "Doc, I went to a holiday party," or "Doc, I did this indoor thing," and now they're getting COVID. And so if you are going to go to these parties, these other things, be very cognizant of that COVID's still here and the Omicron is very relevant. Things that I would consider is that I talked about air filters before. I think air filters or windows open, airflow are important. That when I looked up small gatherings, what the definition is 20 people or less. France is saying less than 6 people or less is a small gathering. So if you're going to do something, keep it in a very small group. One thing interesting is that, again, on the good side, Omicron isn't deadly, as deadly. But the data is showing that 33% of people become long haulers. So what does that mean? That you get COVID, but you never get 100%, even 6 months, a year later. And yes, we do treat a lot of people who have chronic symptoms, and they do get better, but many people who don't do the functional mass or other parts of this. So don't say, "Oh yeah, just a common cold or flu." I don't want you to be one of those long haulers where 6 months, a year from now, you're still battling a cough, a sore throat, still battling lung issues, etc. Yes, we are here at KanodiaMD, but I don't want you to have to come to you. You need us if possible. They're even saying that the airplanes and stuff could be even more contagious now with Omicron than the Delta. I didn't get to look at the articles about how or why, but I guess I'm doing this urgent one is that not urgent, but this on the spot one, spontaneous COVID one, is that really consider what you're doing in this holiday season in terms of your immune system, in terms of who you should be hanging out with, how big the crowd is, how much traveling do you want to do, and where do you want to travel to, etc. Because even before our travel, it's this severe, and then we won't even see the full effects of Christmas and New Year's till mid-January. And in terms of, and last year, sure enough, we had the worst outbreak. Was mid-January was our worst peak. So one thing that they said, which I really liked, which was this is the Harvard School of Public Health, was that if you're going to a gathering, whether small, medium, or large, Harvard School of Public Health is recommending you getting yourself tested, at-home testing. They're not perfect, the antigen testing, but that if you know that you are negative, then, or more likely negative, chances of you giving it to someone else is a lot less. Even if you don't have symptoms, it still may be a good thing to do. Because, again, if you're vaccinated or unvaccinated, you can still pass it on, even if you are vaccinated and don't have symptoms, or unvaccinated and don't have symptoms. I found it to be very enlightening and something that could protect you, your family, your friends, even the immunocompromised, the elderly, the young kids, or people with the severe illnesses. So that's something to consider around your family. I've been seeing reports that it's harder to get the at-home tests. So be cognizant of that. That if you say, yeah, I'm going to go to a shindig for New Year's Eve, maybe buy your test ahead of time. If you can get one, don't wait to the day before to buy it. One question I get a lot is that if you get a positive at-home test, should you do that doctor's test PCR? My answer is yes. The PCR test, that doctor's test, is more accurate than the at-home or rapid test. A study just came out, which also gave me pause, which is why I wanted to bring this up spontaneously, is the monoclonal antibodies. We all talk about it, right? We've all heard about it. If you get COVID, get this. There's multiple companies. Two companies I know is the Eli Lilly company and the GlaxoSmithKline company. The Eli Lilly monoclonal antibody starts with the letter B. The GlaxoSmithKline's company starts with the letter S. They did a study and published study, I think it's published now, where they took people who had COVID and half of them got the Eli Lilly monoclonal antibodies. I guess some did, and I guess all of them got it, the treatment, but some did better, some did actually worse. And they found out that if the body was making antibodies, then it was good to do the treatment. But if the body wasn't making antibodies, they actually were worse. So one of the things that I would want to know to get prepared if I ever would get COVID, and this goes back to, I guess, David Easterbrook's thing about be proactive, is know your antibody level. And there's a test we do called the Wheat-Zoomer test, which measures your immunoglobulin levels. If you have high immunoglobulins, you're already able to make antibodies. But I think that one take-home is that, one, do the Wheat-Zoomer test if you haven't done it. But two, if you don't, then do the Wheat-Zoomer test. And you want to think about getting monoclonal antibodies. If you don't know what your antibody level is, but the Eli Lilly monoclonal may not be the best. It's one thing that you have a treatment. Some people get better, some people don't. But you don't want a treatment where some people get better, some people get worse. I think that's what they're finding, depending on people's antibodies level or immune system. From some of my reading, is saying that the monoclonal antibody treatment from GlaxoSmithKline, the one that starts with S, may not have that same issue as the Eli Lilly. Not 100% sure, but I think that one's harder to find. But if I wasn't, if I got COVID and I was going to get the treatment, I'd try to find the GlaxoSmithKline monoclonal antibody test if I didn't know my immunoglobulin levels. Another thing that come up the study, and thank you for all the questions. I am going to get to these here. Is that what puts us at risk that if we get COVID, we're more likely to be hospitalized, more likely to be on a ventilator. Another study just came out, which was showing the 4 big things: high blood sugar, so prediabetes or diabetes. So the 4 numbers we look at is hemoglobin A1C, fasting glucose, uric acid, and fasting insulin. 4 numbers. I would like your fasting glucose to be ideally below 85, but definitely below 100. A1C to be 5.6 or lower. Uric acid 5.0 or lower, and insulin 10 or lower. In the study, obviously they're going to have the more standard of care ranges on those. Number 2 is high blood pressure. So if you have high blood pressure, you're at higher risk. Make sure you keep your numbers low, however you can, whether supplements, whether nutrition, or your medications. Obesity. We don't realize it, but 2 out of the 3 people on this phone call, or on the Zoom, or not Zoom even, whatever easy webinar this is, 2 out of 3 of us are obese. Sorry, one out of 3 of us are obese. 2 out of 3 of us are overweight. So if you are obese, that's a BMI of 30 or higher, and you can figure that out. There's these online calculators, and I think we've gone over those before, that you can type in BMI, B as in boy, M as in Mary, I, calculator, put in your height, you put in your weight, it tells you if you're obese, overweight, or normal weight. But again, if you're obese, that is a high risk marker. So please be careful during this holiday season. And again, high cholesterol, the top 4. And meaning, if you get any of those 4, you're 25% of them who came to the hospital had really lung issues. And it's the severe lung issues, ARDS. The great news is the Pfizer pill has been approved and will be here very soon. This pill is the one, sort of like Tamiflu or the flu pill or something like that, or an antibiotic. And that if you get COVID, you know it quickly, like within 3 to 5 days. You take this pills at home by mouth rather than monoclonal antibodies like an infusion. It helps you to decrease your hospitalization, decrease your death, like 89% or some huge number like that. That's great, but we're not going to have a lot of it right now. So it is going to be very hard to find. So don't hang your hat that you're going to get the Pfizer pill the next couple weeks or a month. Most likely they're going to keep it for the really, really sick people, hospitalized or et cetera, urgent care, stuff like that. I think that they're trying to figure out how to give it out to and where. I don't want to come off pessimistic, but I also, when I see the numbers, I see the people I'm treating. I don't want this Christmas Eve, Christmas, and the week between Christmas and New Year's to be ho-hum. I want you guys to take it seriously. We're still in a pandemic, and that we should be prudent about what we do, who we do it with, and how we do it. Does that make sense? Yes, no. Please say in the chat box. I'm not here to scare you. Thanks, Jane, and thanks. And so let me go through some questions here. If you have more questions, please put in the chat box now. Now's a great time. So Evan asked a great question. I think I'll praise. If everyone gets a rapid negative test, so I guess with Evan's question, I think I'm gonna paraphrase. If you're going to a party and everyone gets a home rapid test and they're all negative, is it safe to go to the party of 25 people or more? My answer is, I think it's definitely safer. It's not considered a small gathering. We know gatherings 20 people or above are the ones that are more likely to have infections. I would have an air filter or have the windows open if possible. And I would consider wearing a mask, depending on your health status and those other things, for that. But I think that is a really great way of what Evan just said, which was, it'd be great if everyone, if you're on parties where you don't know if people are vaccinated or unvaccinated, you don't know who has the sniffles, who doesn't, that as many people as can gets tested before they go, so that we're not passing this thing on to each other. Jane asked a question. How likely is it for a toddler to pass COVID to adults? I have not seen a study of toddlers passing it to adults as being a prominent way. The things that I have seen is been adults getting it while doing social activities on nights and weekends, rather than even getting it during the workday to some degree. Next question, what's your opinion using peroxide and distilled water and nebulizer a few times a week? I know that Dr. Brownstein recommends it, and I know that Dr. McCullough interviewed him about it. I have not looked at the research, so I can't say 100%, but it makes sense in theory, but I can't say for certain. Brianna asked a question. Are we seeing patients get COVID twice? I've seen patients get it 3 or 4 times. Depends on their immune system, depends on their lifestyle. It depends on if they're a long hauler or not. So it's a really good question. And the answer is, if you got COVID once, you can get it again. And they're saying that the Omicron might be different enough that if you got COVID, a non-Omicron COVID, which probably most of us who got COVID has a non-Omicron COVID, then you're still potentially to get the Omicron version. So yes. The question is, what's immediate steps should we take to not become a long hauler? Let me see if I can share my screen. Last time that did not go so well, but we will try. So are you guys seeing like a million boxes, or are you guys seeing like just one screen? This. Yeah. Okay. I'm gonna stop sharing. My apologies. Okay. How is this? Are you guys seeing one screen now or many screens? Okay. I just messed it up. Okay. Let's see. I messed it up again. Okay. Can you guys see the screen now? Heck yeah, this is awesome. Okay. So let's start with what am I doing for people that test positive? That's kind of cool. Okay. So the way I'm approaching is this. So Jane, yes, we can email it to you. If you, I think there's a way of sending me a private chat in here. If you could private chat your email address, happy to send it to you. So in terms of the things I look at, number one, I'm not sure if yeah, okay. Now we're making some business. Okay. Yeah. Thank you, Jane. Again, this is not my day job. It's not even a job. I don't even know what I'm doing. Okay. I'm just a doctor. Okay. So number one, SPM active. It's on my top left. You guys have all probably heard of chronic inflammation. Basically, when you get COVID, it causes this inflammation that's really harmful to the body, which is why we have all this lung disease, other things like that. So we want to kill COVID, but not kill the body in the process. The SPM actives helps the bad inflammation going on. So we love it. 2 pills twice a day. We also find it helps with body aches, joint aches, pain side of this stuff. But really, I'm trying to do is be able to body kill the infection, but not overkill the body. Research is showing that, and here we're talking about antibodies or the immune system. There's different parts. One is the antibody system, and the immune shield is what's boosting up the antibodies of the body so it can do its job better. The zinc, we know that zinc helps the immune system, so I think zinc's a great thing to take if you're positive. ADK Avail, this may be new for some people. Vitamin A is very lung protective. So I found a vitamin D supplement that has vitamin D, A, and K combined together. Vitamin D, A, K, Evail. We say 1 a day. I've seen studies where people will take 10 of those a day when they're acutely sick. I'm not saying you have to, but that is what I do actually myself. If I have a cold or flu, I'm bumping up my vitamin D to 50,000 units a day to really boost up my immune system, which is 10 capsules a day of those. T cell, and ours might be a different name of it now, but the team knows. Catherine, Susan, Genevieve, and this is the part of the immune system. There's B cells, T cells. The T cells also helps fight the COVID. And we're finding that a lot of people that get hospitalized or get severe COVID have the low T cells, or COVID attacks that part. So I'm just trying to boost up the T cells so our body can do its job to fight the infection. Exclair nasal rinses. It's a nutty pot, a functional medicine version of it. Basically, we find that, and there's actually good data on this, And if we can rinse our nose probably twice a day, we're getting the viral load out of our nose. We get COVID from our friends or family through our nose and through our mouth. So if we get COVID, we're able to rinse our nose out a couple times a day. We're getting it out of our body another way. The antivirals we like are ADP or Virusid. Thank you, Patty, on that. The Virusid, you can see what's there, and then the ADP. I think ADP might be on back order, so we're using a lot of Virusid. I use a lot of Virusid myself. The way I use the Virusid is I'm taking one pill an hour. I first notice someone coughs or sneezes on me. I take it 1 hour until I feel like all the symptoms are gone. So I'm gonna take 5 or 10 pills that day, and I'm amazed at how well that works. So Jane asks, these are the ones that if they're COVID positive, or I guess infection positive. So yeah. Here's the other thing on the infection positive. There's something called inhaled. It's a nebulizer. Same nebulizer we use for albuterol or Duoneb, and we use something called poly-MVA. And so people that are getting cough, the shortness of breath, we're using the inhaled poly-MVA, and we find it's been amazing. So you can get it from our office, this poly-MVA solution, the nebulizer you can get from our office, or we can call in a script to your pharmacy, and then you do it at home 3 or 4 times a day to give the nutrients to the lungs so it can do its job again to fight infection. Let me just touch upon Patty's question about ivermectin for prevention and treatment. So the data I see on ivermectin is pretty good, both for prevention and for decreasing symptoms. I think it's hard to get, and at this point, there's a lot of fake stuff on the market. When I say ivermectin, the studies I have seen are the pharmaceutical grade for humans, not for animals. I don't know the animal version, how well that works. Evan says, I've been taking these supplements for prevention. Is that bad? Is that too much? Should I only taking these for COVID? So in terms of for prevention, so Evan, it's not bad, and it's fine to take these for prevention. I think of prevention as 2 phases. Prevention, if you are vaccinated, T cells are on there, you see immune shields on there. Things for prevention that we're finding, great studies on melatonin. I'm shocked at the studies there. So our melatonin is called snooze power. I think it's great. I take melatonin every night before bed just because the research is so powerful on melatonin. Again, I talked about how do we get COVID? From our nose, from our mouth. So what am I doing? It's called dental sign mouth rinse. 1 pump. I guess I do 2 pumps twice a day. I rinse my mouth for about 2 minutes. I spit it out. So I'm trying to kill any infection that I may have gotten that day from friends or family or coworkers or whatever. I'm doing my job. I think we all have heard about the heart and cardiovascular system related. So there's something called ACE2 receptor This is how it's affecting the heart. So picogenol that we use helps protect the cardiovascular system based on the way that that infection is getting into the cardiovascular system. And I've said this before about what's, that one of the areas that our immune system is the most is our gut. The gut immune system isn't healthy. It's hard to have the whole body immune system to be healthy. We have 70 trillion cells in the body. We have 210 trillion probiotics in the body. So it's like a 3-to-1 ratio. So we're more bacteria than we are human to some degree. And so the best thing that I have found for the gut, for the immune system, is something called Thenobiotic. It's a postbiotic. There's a lot of different postbiotics on the market now, but this is the one that I'm like, wow. The price tag is also a wow, but that is probably another huge thing to get to keep the gut healthy, but not the gut, the whole body. That's a bonus item just because of the price. But for vaccinated, this is how I would approach it. The other thing I think about vaccinated, I think the nasal rinses are fine, and air filters are good. We have them in the office. I have them at home. And the air filter should be on the sheet somewhere. The one we like is Austin Air. If you call our office, I think we give some type of discount for that. For the unvaccinated, there are studies that say a multivitamin, the ADK Avail, a probiotic, SPM Active or SPM Supreme. This is SPM Supreme's a cheaper version. We're not getting as good results, but as the basics for someone who's unvaccinated, and then Thenobiotic. But really, the unvaccinated would be the basic stuff: multivitamin, probiotic, ADK Avail, SPM Active, plus the things up here. And if it's too much, I don't want to overwhelm you. If it's too much, then just take this if you're unvaccinated. Kids are already 17 and below. There's a multivitamin, a probiotic, and omega-3. If you have gut symptoms, IBS, IBD, nausea, vomiting, diarrhea, constipation, bloating, gas, whatever, we have some IVs I think are great. The IV nutritions. We have them on Jumpstart. We also have them gut ones. So probably if you have gut symptoms, I'd probably be doing some gut boosters, not the Jumpstarts, but the gut boosters to keep the gut healthy during this surge time. When we talk about prevention, these supplements, do I want them to be forever? No. I think this surge, hopefully, I'm not a prognician or whatever that word is, practician, I don't know what the term is. I'm not a fortune teller, but this surge may go on for maybe, hopefully by February, March is over. The surge, don't know. So I'm thinking, what would I do for the next 2 months or 3 months or so while this surge is going on? If you're high risk, you have a lot of illnesses, you have autoimmune, you're immunocompromised, you get colds and flus a lot, ozone's the best thing for a prevention. Probably once a week, ozone. We use ozone a lot after people get infections. If you get it, we'll usually see you around after day 7, so like day 8, 9, 10. If you don't have a fever, those types of things. And one of the things we do is do give ozone to those people. And the inhaled poly-MBA. Talked about this already. This is kind of important. If we're talking about 2 parts, a positive diagnosis, and if I'm getting symptoms. Today, a lot of muscles aches, joint aches. We use Midoviv. Helps the mitochondria. Muscle aches and joint aches usually are because the infection is attacking the muscles. So if you give the muscles the raw materials to work, sure enough, those aches go down. General pain at the site of the vaccine, or the general pain in your whole body, then we're finding that the hemp seed oil that we have works great. Some people get gut issues with it. The GI Complete works great. And yep, cognitive stuff, we see a lot of that, the neurochondria or loss of smell we find, brain fog. We use the neurochondria for that. And this is where we're talking about air filters. A guy from Harvard, and I guess I am Harvard biased, of course. Yale sucks. No, just joking. That new study just came out on healthy offices, etc. And they talk about how important air filtration, air ventilation is. That's something new that we added onto the protocol. And that's the protocol, right? Just keep it simple. Is that we've got prevention, we have if you have symptoms, if you get diagnosed, and if you have symptoms. And if you want the protocols, if you put your email address in the chat box, and again, just to the host, which I think is me, I'll send that protocol to you. Also, my team has it too. David asked a question: are you willing to institute the practices of the early outpatient treatment as outlined? I've not read that study, so David, I can't answer the question. William Christians, and if I mispronounce your name, I apologize. I'm not the best with pronouncing names. Do masks really protect? They've done the studies. The answers are yes. The masks really do make a difference. And I guess the reason is that we most likely get COVID from our nose and our mouth. The other place to think about it is from our eyes. So if you have a choice between contact lenses and eyeglasses, right now is a great time to wear eyeglasses. It may not be sexy, but great way to wear them right now until this surge is over. David asked, there's a shortage of the monoclonal antibodies. Where and how do we get it? Yeah, I had a patient yesterday. They were vaccinated and they had a hard time finding it. So I'm not sure the best way. But I will say, based on the research I showed, I'm not sure that I'm the first one to jump on the bandwagon for that right now, especially if I've got mild symptoms, because the Eli Lilly may actually do me harm. One, and so and I don't know how easy it is to find the GlaxoSmithKline version right now. So that's not the first thing I'd be doing for myself. Patty says, that they're using the molecular iodine rinse and the nasal lavage for pre-rinse in dental patients. Molecular iodine has been shown to inactivate SARS-2. That would make sense. I don't know the research. Yeah, Patty said, how do you feel about people using hard to get testing, or social affairs, family affairs, when sick people need them and can get them. It's this catch-22. Don't think that there's a perfect answer. If you feel like you're taking a test kit away from someone else, don't get it. I can just tell you what the Harvard School of Public Health is saying, what other organizations and health leaders are saying regarding things that we should consider this holiday season. I'm not saying to hoard them. I'm saying to use this judiciously. If you think you're going to go to a party that may have people there that may be unvaccinated or may have symptoms, or you yourself don't want to give it on to other people. Jane is saying that I'm reading The Rapid Virus Recovery by Thomas Levy. Yes, I have that book. Haven't read the whole thing yet. Thank you, Jane. Thank you, Patty, about that research. If people want to see that on the chat box, it's there. Yep, Jane, if you can, I think I might, Jane, have your email address. I'll send that to you. Thanks, Patty, about the XClear. So yes, Jane, question Jane asked, which I think is kind of relevant, is that if you're not my current patient, can you still order these supplements from us? Or the other thing, the answer is yes. Just contact the office, or contact us via the office, call us, or there's a, on the website, there's a contact us, and you can put your information there for an email. Emily Smith talks about colostrum. Colostrum, you know, can't argue with colostrum and good gut health there. A lot of people love colostrum for gut health. Don't know the research that well, and have not used a lot of it, but it makes sense. I think some colostrum, we need to be careful if it's dairy free or not. Sometimes colostrum is made out of dairy. Some people are dairy sensitive. Thanks, Angie, for that positive message there. You also got to give a private chat. So I guess if you guys want to email me, just put your name down, say on a chat box, yes, I want it. And I actually should have everyone's email address who's on here. So you don't have to put down your email address for the general public if you don't want it. David talks about the Beamer device. I don't know how many of you guys know about the Beamer. It's a medical device out of Europe. It's a pad. Looks the size of a yoga mat, hooked up to a computer. It sends you signals. And what's cool about these signals is research-based, and they have like great YouTube videos on it. And but basically, it improves your circulation by about 30%. So what we do, which is kind of cool, is that we'll jump on the device, sit on it, well, not sit on it, but lay on it, sit on it, whatever you want to say, for 8 minutes, and then take your supplements, and we find it'll be much more effective, 30% more effective. So it's pretty cool, actually. David Easterbrook's at our office. He shows people how to use it for free, and then you can rent out the device if you want to, and then from there. But if you're interested in trying out the Beamer device, contact the office, and David, and they can put you together. Or if David, if you want to put down your email address or phone number there in the chat box, they can contact you directly. Kevin says you could do a group email. Great idea, Kevin. As usual, once this recording is done, the team will do its fancy stuff, and we'll send an email out to our email list, everyone that attended this, and in there we will attach our protocol. So there'll be a link to hopefully to the YouTube video or the video and our protocol. If not, you can contact the office. So the question was, if on the budget, what 3 or 4 things would you suggest? Great idea. So Jane, are you vaccinated or non-vaccinated? If I may ask that question. So if you're vaccinated, I would say that if I had to pick the things that would make the most benefit: T cell, immune shield, and melatonin. If I could add a 4th one, the dental Sidon oral rinse. David Easterbrook put his phone number and email address on there: 760-845-0427. Easter, like the holiday, Easter Brooks, Brooks, D as in dog, Brooks D at AOL.com. Other questions is, how effective is Biomat versus Beamer? 2 different technologies. We use a Biomat in our IV rooms. We use Beamers for circulation. So different things for different things. But overall, I've been saying for immune system and better use of supplements, medications, and treatments, Beamer is the way that we find it to be. Jane, the question is, did you consider you're vaccinated with only 1 jab? That's an ever-changing question. It's some people saying now you need all 3 with the booster included. Some people are saying just 2. I would say the Johnson & Johnson 1 shot is probably not enough. I'd probably at least get a booster if you want to consider yourself vaccinated, big picture wise. For the unvaccinated, great question, Evan. And I don't know if you've heard the Zoe study in England. Great study, huge amounts of people. For the unvaccinated, let's see if I can do this. Okay. Yes. Okay. Unvaccinated. If I had to pick my top 3 or 4 things, and if you're on a budget, the therabiotic, symbiotic in the middle, ADK Avail, and the multivitamin. If you're on a budget, those are top 3 I would pick based on the research. Sorry again to do this, for you guys here on a Thursday evening, but just being seeing a lot of COVID, and I want to get you guys this information so you can think about how you want to handle Christmas Eve, how you want to handle Christmas next week, and the holiday season. Because things have changed rapidly in the last 2 to 3 weeks, I am seeing. Yeah. So we'll end there. I'm going to see if I can get everyone's names down again. If you want the email, so If you don't want the email, you can get off of it. I can't say bye yet. If I say bye, I think all the chat's gone. So I'll say bye to everyone who's done. And if you want an email, if you want a personal email, I'll send that now. Otherwise, it'll be, I'm not sure, after Christmas or something. I'm not sure when we're going to send that email out. But I really appreciate everyone attending. If you get this, please subscribe on YouTube. If you see it on Facebook, please like it. When you get the email, please forward it to your friends and family. We want to spread the information that's both sides. So Emily Smith, you can Google her name. Just something called Halo Therapy. You can contact her office about that. But thank you guys for your time tonight. And do your best to be happy, healthy, have a great time. I'm not worried about COVID, but I am going to do my due diligence. So Merry Christmas, Happy New Year to everyone. Bye-bye.